Hi to everyone here this evening, and at the moment there's only a couple of us here. My name's Shane Murphy, and we are here to talk about your career in healthcare and healthcare management specifically, realistically. I'll just be hosting this tonight because I don't know very much about this area, so I'll be asking questions. And with me, as you can see on screen, is Dr. Mohamed Khalifa, who's one of our senior lecturers at the College of Health Sciences, and he will have a lot of the answers. And we also have in attendance Stephanie from our course advisory area, who will also be here to answer questions specifically about how to get into courses and do things. Now, as you can see, there's not a lot of people here this evening, but I figured that we might as well just sort of push on. We normally allow a couple of minutes with most of these webinars to allow people who are running a minute or so behind to enter. But how are you this evening, Mohamed?
Very good. Thank you very much, Shane. It's my pleasure to be here with you and share our future students in this online webinar.
Yes, and thank you for putting aside the time to do it. It's these things are important, I think, because they do give a great, as Alice is just saying, they are a bit of an opportunity to get some insight direct. But it's very hard when you're going for a course which might take up 2, 3, 4 years of your life part-time to understand what's really involved. So this can give you a little bit of a help along the way with all of that as well. And maybe what we might start off with doing, just for a bit of, we'll sort of start at the opposite end first. I thought it might be worthwhile just having a look at what the end goal is. This is data from, I believe, the New South Wales healthcare system, isn't it, Mohamed? These are the sorts of salaries that people in the medical system can earn. Is that correct?
Yeah, right. So we have as health managers, the award by the government decides the levels. We have 6 levels: health manager level 1, level 2, 3, 4, 5, until level 6, based on qualifications and experiences, of course. And then we find that by 2023, we have a maximum for each of these levels as a salary. And we notice that it increases up to almost $200,000 every year with health manager level 6. Health manager level 5 are usually hospital managers. Health manager level 6 are they work usually in the district, in the health district, in the Department of Health, not in the public hospitals. But health managers level 1 and 2, they are mostly the nurses who are managing the projects within smaller departments. And then levels 3 and 4, they manage larger services and larger projects.
Right. Yeah. So it sort of gives us a bit of an idea about roughly what we're aiming for with this. And so maybe just can you tell me a little bit about what a career trajectory might look like in the health industry these days in Australia?
Well, one of the good things is that this is a very high demand specialty which is health management. And people come from different disciplines. Let's say like 60% comes from the nursing background, and then the other 40% come from different specialties and professions, being doctors, being dentists, being nutritionists or dietitians, physiotherapists, and other career areas. And then it all depends on how we as health managers, because I used to work as a health manager in hospitals more than 15 years ago before becoming a university professor or an academic. So we come from different backgrounds, from different healthcare and non-healthcare sometimes, like accounting and IT and so on. So the career is usually based on how ambitious someone is and how they are enthusiastic to join management or managing healthcare services on different levels and scales, like operational or strategic, like frontline managers who manage directly patient relationships or services or work on specific projects like reducing waiting time and so on. So the perspective or the trajectory of the career comes mostly from the clinical background, like being a clinician. And then when we realized that we could be of more value to more patients rather than individual clinical settings, treating or managing one patient at a time, then most of us like think of, so we can do something bigger, something could be on a higher level. So we join health management as a discipline, and then the career takes us from our clinical areas like nursing and medicine into managing services, improving performance, reducing waiting time, improving efficiency, improving patient satisfaction, reducing hospital-acquired infections, different areas that we can serve. Yeah.
Absolutely. By the way, I have neglected to mention that if you want to ask questions, there's a couple of ways to do it. You can put some stuff into the chat or the Q&A, and we will get to your questions. And alternatively, we also just raise your hand because we can actually let you speak. Given that there's not a lot of people in this particular session, it's not going to be too much of a problem for that as well. So feel free to ask questions at any point during this as well, because that's really what this is about. Okay, so that's really interesting. Is that the sort of career path that you had? You said you used to work in hospitals. You're a doctor originally, were you, Mohamed?
Yeah. My background is medicine. I started as a medical doctor in 2001, and then I studied health management. But I was trying to study health management, not to become a health manager actually at that time, but just to increase some of my skills and knowledge in that specific area. But over time, like 2 or 3 years after that, I found myself more inclined to join the management teams because I thought I could fix the system, fix the inefficiencies like long waiting time, fix the problem with the hospital-acquired infections, fix the problem of lowered patient satisfactions, complaints, incidents and reports, and things that could happen like adverse events and major serious events that could happen with patients when they are wrongly identified, or major things like wrong side surgeries and drug interactions and other things. So I use different tools like health information systems and clinical decision support systems, information systems to reduce these incidents and improve the efficiency of the performance and improve the quality of the healthcare itself.
So they're the sort of areas I suppose that the course covers. I will delve in and out of the Master of Health Management course. So what are the subject sort of areas that it covers?
Well, the course itself, it covers 10 major units, which are all mandatory. For example, the first unit is an introduction to the Australian healthcare system. The second unit is about clinical governance and quality in healthcare. The third unit is about health management and leadership. Unit 4 is about evidence-based practice and using research outcomes in clinical practice, clinical guidelines, and recommendations. Unit 5 about digital health and information technology. Unit 7, for example, about change management. Unit 9, the statistics and epidemiology. Unit 10 is about finance and economics of healthcare organizations. And then we have a double unit at the end, Unit 11, which is equivalent to 2 units. It's a capstone project unit where students do research in healthcare, exploring areas that are representing challenges in facing the healthcare systems, like inefficiencies or waiting time or infections, or even using AI technologies to improve performance of different healthcare services and so on. Yeah.
It sounds like it actually really does cover quite a lot of areas. Almost the point of being a bit scary to go from, I heard the word statistics mentioned in there and epidemiology, which sounds quite complex. And on the other hand, health informatics and things like that. I'm assuming that they're all structured in such a way that you bring people along the journey rather than expect them to have much prior knowledge.
Yeah, of course. But every one of us has like our own preferences. So someone could come with a preference for quality, for preference for performance, preference to communicate with patients and talk to them. So this is how we can see the health management as a wide range of disciplines coming together and could represent a group of subspecialties later on. When someone graduates with a Master of Health Management, they can work in different areas based on their set of skills and preferences and experiences and knowledge as well. So if I'm a nurse, I could focus on patient satisfaction, quality improvement. If I'm an accountant, for example, I could focus on the finance and economics of health management, aspects of organizations, primary care, secondary care, and so on. If I was a statistician, I could work more into performance improvement based on statistics and informatics. If someone is an IT in their background, coming from IT background, they could focus more on digital health, implementing health information systems, electronic health record systems, clinical decision support systems in hospitals. So all of these are considered like disciplines, or maybe you can call them subspecialties within the health management.
It sounds a little bit like, would it be fair to call it an MBA for health professionals?
An MBA is a little bit different because an MBA is focused more on the business side of the process. The Master of Health Management is focused more on the clinical side. So an MBA is better suited for those who look for becoming business-oriented, focus more on strategic management of the finance, revenues, profits, efficiencies of the system, cost effectiveness as well. But for those who come from nursing background or medical background and they would like to stay connected to their clinical practice, or would like to be a frontline operational health manager, they might prefer the Master of Health Management rather than the MBA with healthcare specialty.
Yes, I can see where that works extremely well.
Yeah.
And would you believe I had a question that has completely lost my mind now as I was looking at you? But I can be a clinician and a health manager as well, though, can't I?
Yeah, you can, definitely, because being a clinician and then deciding to be a health manager has a very good advantage, being able to understand the different cycles that someone goes through. For example, when we face a problem in inefficiencies like waiting time in emergency department, we might think that this is an emergency department issue, but then we discover that inpatient beds are in shortage. We don't have enough available inpatient beds to admit patients from emergency department. Then the problem is not in the emergency only, but also in the inpatient services. So if you are a clinician, then you will be able to understand how these different cycles are linked together, how they represent the throughput from one point to another. The outcome of one process or one step is the input for the next one, and so on. It's like a chain. It's like the supply chain. So this will help you a lot. If you are a clinician, then it will help you a lot in understanding the relationship between these different components of the healthcare system itself.
I've actually moved to this slide where we're talking about that sort of stuff. And what qualifications would I need to enter the course and become a health manager in that sense?
Most of our students come from bachelor degrees in nursing. They could have already studied business or management. They could have bachelors in public health. But based on the current statistics, almost 50% of our students are nurses. And actually, more than 60% of health managers are nurses worldwide, not only in Australia. So, and this could be justified or explained clearly because nurses represent the major workforce sector among all healthcare professionals worldwide. So we receive different students from different backgrounds. Last year, 2024, we had like 6 doctors and maybe 12 or 13 dentists, like more than 100 nurses, and so on. But we still have physiotherapists, we still have lab technologists, we have IT people coming from IT background, and they would like to shift into managing healthcare services rather than managing IT systems, and so on. Yeah.
I was going to ask you about the nurses actually, because I've been getting the impression that a lot of nurses do the course, and it makes sense that given that nurses are the ones on the ground with the most number of staff in the organization. What sort of skills do they need? I can see there's a bit of a list here on the screen, but how does that pan out in real life? Because a lot of it's about people management as well, isn't it?
Yeah, it is. It is. It's related to managing teams. It's related to leading these teams to achieve a common goal as part of the strategic planning, financial planning of the organization or one service, for example. They have to have like some kind of problem solving, as mentioned here in the slides, and knowledge, of course, of regulatory, ethical laws and things that are related to the legal sides and aspects of healthcare services. Statistics also, as you mentioned, maybe could be a little bit frightening for some people. We don't like math or statistics, that's right, but it's part of the domain. So if someone likes math or statistics, simple statistics, because we are not teaching them to become statisticians, of course, but health managers have to understand statistics, and they will be understanding statistics after they complete this course. But some people like computers, for example, IT. I could be a nurse, but I'm very talented in computer. For example, writing, preparing PowerPoint, searching the internet, or doing simple statistics on Microsoft Excel or so on. So I could use these skills as a health manager later on when I do timetabling for my team, when I do improvement of performance for my service, like emergency, like lab, calculating the turnaround time for lab results, calculating the bed turnover rates, occupancy rates in hospitals, developing new KPIs. I could also be part of the project team, for example, an IT team developing a dashboard or developing a scorecard for a service. A dashboard is like a very big TV screen we can place in different areas to show how many people are in the waiting area, how long on average someone is waiting, who is ready for the next step, whose results came back from the lab, so that the doctors and nurses can move to that specific patient and reduce any lost time between these different, let's call them checkpoints or stamp areas or stamp points within the system itself.
I suppose hospitals are very large and complex organizations, and that's why so many TV shows revolve around them, I guess, not to mention life and death going on. But what sorts of other organizations would people in health management work in?
They could work in areas like health insurance. They can work in aged care facilities. They could work for the Department of Health, as I mentioned, in the district, in the healthcare district areas, local health districts. They could work for technology companies. I have seen a lot of nurses working for health information systems, implementing electronic health records, training the nurses and the doctors on how to use the technology, how to use electronic health records, how to use dictation systems, voice recognition, automated reporting systems, and so on. So they can work in different areas, not just the clinical areas of the hospitals or clinics. They can work in different organizations and services. Yeah.
Absolutely. I should at this point remind everybody, because a few people have joined since I first mentioned, that if you want to ask a question, feel free to raise your hand or to pop something in the chat or the Q&A, and we'll get back to you as quick as we can. But also thought it might be good to have a bit of a pause now and have a chat to one of our existing students. We've invited Anita along this evening to talk to us as well, and she's been studying with us for how long now? Are you there, Anita?
Yes, so I'm going into my third trimester.
Which is what, 3/4 of the way through?
No, no, no. What is it? Just a quarter? Yeah, a quarter. So 3 subjects.
Excellent. Excellent. And what made you want to do a health management master's?
Yeah, I felt like I was kind of thrown into healthcare. It wasn't my first degree. My background was more in the business and marketing side of things. And I found myself in situations dealing with doctors, hospitals, physios, and I wanted to grow my knowledge and background in this area. And the
Ah,
course,
great.
yeah, it's been great for that. I have learned so much.
By the way, is your camera turned on? Because I can't see you at the moment.
No,
Yeah,
I can see her. I can see Anita.
Oh,
yeah,
good. You
yeah.
you
I
can or you can't?
think so. I can see myself.
Ah, there we go. There you are.
Excellent.
Excellent.
Yeah,
Welcome.
thank
And so
you.
you weren't a nurse originally.
No, I wasn't. No, and I felt I really needed to work on my skills. But one of the things I've really enjoyed about the course is there is a real mix in the workshops every week. So aged care, nurses, theatre staff, people like myself. And when we start talking through the topics, that diversity of background makes for interesting discussions.
Absolutely. So how have you found it so far? You're, like you said, about a quarter of a way through. It's often when, people might start to feel a bit burnt out after all that hard study. How's it all going?
Yeah, no, it's really good. We actually requested for more subjects. um, yeah, no, really enjoying it. It's well planned in terms of managing lifestyles. So the sessions are of an evening during the week. When the subjects for this trimester are launched, all the assessment dates are laid out, all the module course information is there. So we can go through, and we go through at our own pace, that material. So I juggle it around my schedule. I have an unusual schedule. I'm up very early and to bed late. So I can do it when I need to. And I really appreciate that. And the online course material is really interesting. It's not dry textbooks. There's videos, there's interviews, there's media clips, PowerPoint. And there's little quizzes that it's not for marks or recorded, but it's to help you check if you've grasped the concepts. So it's interactive and interesting. And then once a week in the subject we meet, and normally the professor will run through the highlights. If you've missed it and you've had a really busy week, which some weeks can really help, and then we normally break into workshop groups and discuss certain questions.
Oh, that's good. So you do get a lot of interactivity with the other students as well as with the teacher.
Yeah. In those workshops during the week, you do, and as I said, the diversity of background is interesting and helps you grow. But it's still small enough, so it's not you're not in a large university degree of 60 people where you're just a number. There's about 10. And you get to know each other, and the professor knows your background and kind of guides you, because everyone's got strengths in kind of different areas. So that's really helpful.
Wow.
Yeah.
Do you think that you formed like friendships in that group that'll continue on past the course eventually as you get into some of those projects and things?
Quite possibly, yeah. Definitely business networks and things, that's for sure. Yeah, you do. Depending on how many subjects you do spend a bit of time together, which is good.
And have you found the study load as well? How do you fit it all in? You said you get up early and go to bed late. Hopefully that's not just because you need
No,
to study,
that's
but
my work. No, the study is excellent. So you know the dates up front at the beginning of the trimester. There's normally 2 to 3 pieces of assessment, and they're assignments. They're not pressurized exams. So there's not that stress, and you can plan out and balance, when you do your assignments so that you're ready for the due date, they're well in advance. and you can plan to review the course material when it suits you. Yeah, it's been very well paced.
That's good. I'm assuming you've probably got a family as well as your job and all sorts of other stuff going on in your life as well.
Yeah, you do, but everyone does, and I think it's been good. CHS has understood that, and so like even this trimester, they've put 2 subjects on the same evening for us, so that we can go from one to the next, rather than have an additional night, which really, it's really considerate and thoughtful, because it makes it easier to juggle it around, work life. Yeah, no, really well balanced. Yes, and I said we asked for more subjects. So
Gluttons for punishment.
yeah. So it was good.
So, and what do you expect will happen when you're getting towards the end of your course in terms of how it fits in with your work? Is it going to directly contribute to the job role you have now, or are you thinking about getting another job, or without getting into too much personal detail, of course?
Yeah, no, I'm finding I'm quite evolving. So I did it for a particular reason, but I'm discovering as I go with the subjects, I'm learning more about myself and what I like and what I enjoy, and things that I never knew would interest me has sparked a whole nother set of interest. So I don't want to say what I'm going to do when I'm finished, because I think it's still going to evolve as I do more subjects. And I'll wait and see. Yeah.
That's amazing. It sounds like it sounds like you're in a really good place with it at this point in time.
Absolutely. One of the best things I've ever done. That's for sure.
Wow.
Yeah.
And I will encourage people, if you've got any questions to ask Anita about, the reality of what it's like, you can speak to her directly while we're here. We can't, we can't intervene in what you ask. You can ask, are the lecturers good? What's going on? All of that sort of stuff. It's always good to know those things, because I think when you're starting a new course and you've got no idea about anything, unless you've spoken to people who have done it, it's very hard to get a really good feel for what happens when you go in, particularly if you may not have studied for a reasonable amount of time, I would imagine. Had you studied much before, Anita?
No. Most of mine was work practical experience, and I was really nervous going into it, that's for sure. So if there's one piece of advice I can give, it's don't fear it. If you need help, you ask for it, and the professors are amazing. They'll get back to you in almost 24 hours. They're super quick. If you need help with anything, they couldn't be more helpful. So there's really nothing to fear. Just give it a go and see what you enjoy and go from there.
So I think quite a lot of our students come to us without a formal bachelor. There is another path through to do a graduate certificate first. Would you have any idea, Mohamed, on about how many people come through the career pathway where they've got work experience?
Well, I think like a quarter of the students come for they start with a graduate certificate. Maybe just this is a new information for our new students here. The program itself is nested into 3 levels, so that when students finish the first 3 units, they can exit the program with a graduate certificate. If they did 6 units, they can exit with a graduate diploma, and then when they complete the whole 11 units, actually 12 units because the last one is a double unit, they graduate with a master's. So maybe 25% of the students start with a graduate certificate, but we find that most of students become more interested to continue towards the graduate diploma and actually towards the master's. But it's a good way to start with a graduate certificate, to just have the first 3 units first, and then understand from there if studying is good, if they can manage their time. Anita, for example, was really doing very well, and she could manage her time as she described very well. And all of us, when we studied health management in the early days, we just found ourselves more interested. I found myself more interested into digital health. This is why I did my PhD in health informatics. So other people could find themselves more interested in quality or infection control or public health, different areas from that point. So this is a good way to access the program and get yourself engaged as a student. Some students prefer to start with only one unit, and then in the second trimester, they could do another 2 units. And then from that point, they can decide if one unit is enough for them, or they would like to take 2 units each trimester. Then they will finish between 2 and 4 years based on how many units they study each trimester. A trimester is 3 months. It's a 12 weeks term, and we have 3 trimesters during the year. So if someone started this February, they can have the 3 trimesters during 2025. So they could study 6 units. And then 2026, they could study the remaining 6 units. Then they finish in 2 years. If someone is studying more like part-time, 1 unit and then 2 and then 1 and then 2, they could take like 4 years and finish the 12 units or the whole degree of the master's degree. Yeah.
Great. Well, if anybody wants to ask Anisha questions while we're here, I can see there's something in the Q&A at the moment. I should have a quick look at that before we move on. Is it blended like online and on campus? No, it's actually, well, you can do on campus, but
Yes.
in this particular course we're talking about is entirely online. So Anita, for example, lives in Brisbane, I believe, and the campus is in Parramatta in Sydney. So you can actually do either way, but we're primarily talking about online at the moment. Yes, Mohamed?
Yeah, we have 2 campuses. We have one in Brisbane and one in Sydney. So, and we are planning in the near future, within maybe 1 or 2 years, we could have a third one in Melbourne. So we still have face-to-face teaching in Melbourne, in Brisbane and Sydney, in the 2 campuses. But for the domestic students, they can study entirely online. But if someone is interested to attend one of the units, for example, on campus, they can do that.
Right.
Yeah.
My apologies. This is what happens when you do these things when you've only been doing it for a month and not remembering about the campus in Brisbane. So apologies about that. Thank you for correcting me. I will swap over to asking some more questions of you, Mohamed, now while we're talking, and thanks, Anita. But we'll circle back if we can get some questions later on. What was I going to say is health management a high demand career? What's the demand for those sorts of roles that we were talking about earlier on with all those nice numbers at them?
Yeah, well, based on the government reported numbers, the Australian Institute of Health and Welfare, we have some statistics saying that within the coming 5 years, we need 18,000 health managers. So 18,000 is a huge number. And we're still in shortage of those numbers. This is why you can find, for example, you can find health manager on the top of the list for immigration, for example. Why is that? Because we need more health managers. So it's a good opportunity for people coming from inside Australia, for domestic students, and also a good opportunity for international students to come to study and then do the immigration to Australia, move to Australia. So this indicates how we have a huge demand for health management. We have a growing sector, which is the aged care. We all know that Australia is one of the top countries in the life expectancy. We have the life expectancy average males and females between 84 years and 85 years, which is maybe the second after Japan, and one of the top among the top 10 worldwide. So this aging population has so many demands for health managers, for nurses, for health professionals, because we have more aged care, home health care. So we need more health managers to arrange and coordinate and manage all these types of services.
Right. And as I said, as we were saying before, you can transition from non-healthcare background into health management as well.
Yes.
Sorry, what would you need to get into the course? Presumably a bachelor's degree in another area, or would work experience in a related field get you in?
A work experience in the related field of healthcare helps you as a student to join the master program directly. But if someone does not have the required experience, but they still have the bachelor level, they could join the graduate certificate first, which is a pathway to the master's, of course, because they study the same topics, the same units, and they attend with the other students.
Right.
So someone could be transitioning from non-healthcare background into management, definitely, yes.
Okay. Here's a question which I'm not sure if you can answer, or maybe Stephanie can. International students, what visa subclass do they need to have? Do we know?
Oh, hi everyone. Hi Shane.
Stephanie is our course advisor, and she can advise on this.
Mhm. At the moment, we do not allow international students to study online domestic. But to answer that question, that is subclass 500.
Right. That's for the face-to-face students.
Yeah, that's for the
Yep.
face-to-face one.
Yep. Great. I thought we'd just get that question out of the way while we're there, and then we'll go on. So in terms of career progression, where do you sort of start and where do you end up, do you think?
Well, career progression usually starts with operational management in healthcare. For example, if I'm a nurse and then I would like to become the head nurse or the head of the intensive care department, for example, or inpatient admissions, or the project manager for the quality management and improvement or performance improvement, that could be a very good start. And then over time, when someone has the experience, like 5 years or 10 years, they become like chief operating officers, chief executive officers, chief digital health officers, based on the areas that they have either qualified in or have most of their experience in. So it's a very nice journey, and having a clinical background could be a very positive advantage for those who are joining this career. If someone is coming from a different background as well, from non-clinical or non-healthcare, they could have an advantage being business-oriented, being accounting-oriented, being profits and revenue cycle. They understand revenue cycles, managing resources, and so on. So they could come from different areas, and this could be a very good advantage for them.
Great. We've talked a little bit about the challenges that health managers face, and I imagine that things like COVID over the last few years and technological change will be right up there with the things that have been thrust in front of people recently. Is there, are they the sort of things that people jump straight out of the course into doing? Do we find that people, usually they do the course and then they're probably promoted within 12 to 18 months afterwards?
Well, some of our candidates or students, they get into the master program or the course to get promoted within the same track or the same discipline. And some, as Anita mentioned, they join the program just to do a kind of a career shift from one discipline to the other, to another one, which is fine. It all depends on how someone sees themselves in the next 5 years after the program, what they will be doing or what they will be focusing on more. Some might say, no, I would like to take myself to the next level, to do a PhD, to join a research organization, to do more research in hospitals or more research in universities or in academia. So it opens doors to different pathways after we finish this program as a student, as a candidate. But definitely they will have a good idea about what they are going to be doing, especially for the domestic students, because they come already from within the market, from within the area where they have already the job. For international students, it could be a little bit different because they will be coming to Australia. So this in itself is a big shift from a country to another country. And then joining the market, joining the area in Australia. This is also another challenge for them. Applying for immigration, finding the full-time job. But I have seen like 95% of the international students finding a job within a few weeks after they arrive and start their studies in this course.
Wow, it really is in demand. And I really should have asked this question and got to check in on the answer beforehand, but I'm going to ask it anyway and risk falling on flat on my face. Do we have a few people who are alumni from the courses who are, you know, CEOs, CFOs, chief digital health officers, etc.?
Yeah, I think we have a couple of international students who have been successful in securing immigration, permanent residency to Australia. And they have also been offered a full-time job as a health manager in I think it's an agency for aged care. It's an agency managing like 5 or 6 aged care facilities. And she is now, she is a medical doctor, and she came from, I think, Nepal. And as far as I remember, she has been offered this job just before she finished her capstone project, because she was already working in that aged care facility before. And then she was offered a full-time job after she can transition from student visa into the permanent residency.
Wow. So, yeah, I suppose in the end, that's what it boils down to. It does have good outcomes. I did get a little warning saying that we're getting very close to the end of our time. So I would encourage people to just ask some more questions. And as we start sort of slowly wrapping up, I think it's important to think about, if you have got questions that you want to answer afterwards, that Stephanie will be around to answer any questions that you have. You can ring our phone number, which Stephanie will tell you what that is.
Yeah, Shane. So we have sent quite of our students all the emails and information, and after the webinar as well, we will send them an email.
Right. Great. And you can contact Stephanie to talk about how you might map it out, what you need to do to get ahead. We do have an intake starting in about 3 weeks on the 10th of February. And, you know, there's a little bit of leeway around that for joining for this first intake. It's often good to start earlier in the year, because then you start to make progress, and your master's doesn't stretch across 3 to 4 years. You can get it done in, 2 to 3 years, but by starting earlier in the year as well. So it's good to, when the year is fresh, to have a bit of that motivation around you. And that is, I hope, the most salesy thing that I say during this conversation. And I hope that, you've got something out of it, that we've been able to give you a little bit of an insight. I would ask, please feel free to ping any questions up in the last couple of seconds that we've got online. But I really would like to thank Anita for joining us, because she's done that completely out of the goodness of her own heart. And it was wonderful to have her along and to hear a story. I think it's always important to hear directly from people who are actually doing the course and probably facing the same challenges that you might be facing as somebody who's about to join the course or thinking about joining the course. It's good to get the real, the nitty gritty. And also a really big thanks to you, Dr. Mohamed Khalifa, for, spending your time telling us about everything. It's nice to hear from you. You're so engaged with your subject.
Thank you very much, Shane. I'm really thankful for you to give us this opportunity to participate and host this event. Thank you very much, Shane.
No problems. And just in closing, I would also like to thank our backroom people. Well, Stephanie is actually more of a front room people usually, because she often does these, and she is around, and we'll say goodbye just before we go. And also Alice, who has been organising everything and keeping an eye on all the stuff. And I see, just as we're about to sign off, there is a question from Amy. What would be the best possible role to enter healthcare as a health manager when you're from a non-clinical background and don't have any prior experience?
Well, that I can answer that question, because if your background is not health care and you are coming from a different background, your background will be coming with a set of skills and and knowledge areas. And then during your study, you will find yourself more interested and more enthusiastic about one or more of the areas that maybe I have already mentioned, like health management, leadership, informatics, digital health, technology, statistics, epidemiology, research, quality management, and so on. So you can invest your background and skills in one of these areas. You could fit also in more into strategic management rather than operational management. Operational management is more about managing the day-to-day activities, while strategic management could be more into planning healthcare services over the next 1 or 2 years. But operational management could be like day-to-day up to maybe a week or something. But over time, you will find yourself more engaged with other people because healthcare works in teams. So you will find yourself part of a team. And then from that team, you could find yourself more interested in areas that you never crossed your mind because you haven't been there yet. But definitely, it's a very interesting discipline to join. Yeah.
Absolutely. Well, in closing, I think it's probably time that we finished. I would imagine there's actually quite a lot of people from IT that join health at the moment because there's such huge challenges and opportunities in information technology for health. But again, thank you to everybody for attending. And we look forward to sending this out to everybody who did register in the next few days. And there will also, I think eventually we'll be posting it online as well. But again, have a lovely evening wherever you are. I hope you're safe and well. And we look forward to speaking with you soon. Good evening.
Thank you very much.
Thank you.